Students here with my two daughters. That's Chloe and this is Hannah. And we're working from home today, and I'm actually on my professional practice day. So if you have any questions, you will have a replacement teacher and they can correspond with you throughout today's lesson. But if they're unable to answer anything, just hold your questions until our class on Wednesday, or simply send me an email and I'll get back to you as soon as I possibly can. Okay, so I just want to go through a few things with you about today's lesson. And the first thing I think is really important to do is to go back to where are we at within this term and what are the things that we actually need to look at. So last week was all about reintroducing the concepts and the dimensions of health and well-being. And then this week we've actually moved into this topic here, which is the measurements and indicators of the Australian health status. So we're actually now not looking just at an individual and looking at a case study of somebody that's presented to you and what are the 5 dimensions that make up their health and well-being. Now we're actually looking at our country, Australia. And I mean, right now we're all in this pandemic, and some parts of Australia it's worse than others. Victoria's got the highest numbers of all, and then you switch on the television and you're watching the AFL, and they're in a hub in Queensland and New South Wales where they've ended up having players out on a football field acting like normal pretty much, and you've even got a crowd of 30,000 people in a stadium, whereas at the moment we in Victoria we're in lockdown. And so sometimes even within Australia, as you'll find out from today's notes, it needs to be broken up into small pockets of Australians and different areas that make more sense together. So as we move through this, the work from today's lesson, which will be up on Compass that I've written out here, so once this video is completed, I'll paste it into this YouTube link and it'll go up onto Compass. I wanted to show you now where to access this. So reminder that in resources, I've already pre-uploaded most of the stuff. For today, in Term 3, Week 2, you're going to require this PowerPoint if you want to follow along yourself. I have made one change which I didn't upload that is shown in the video, and you'll also need the new glossary here. You do not need the Venn diagram for today. I've also created a learning task called Term 3 Week 2 where you'll be able to upload the work into. Now just a little reminder here that I don't have everyone's Term 3 Week 1 work. Alright, so it's a good idea to make sure you stay on top of that and don't fall behind for if you did complete it and you want to re-upload it today. So here's the glossary, okay, burden of disease, disability adjusted life years, health indicators, health status. There's a few like life expectancy, okay, prevalence, health status, health indicators that you'll be able to fill out today, and the rest of them might come in Wednesday and Thursday's lesson of this week. So let's get started. As I go through this PowerPoint, there's a few little tasks that you're going to be required to complete, as well as taking some notes. And if you take those notes on Microsoft Word, that might be the easiest way to upload at the end of this session. So, the Australian health status. I'd like you to take some notes about these couple of dot points here. When we refer to the word health status, which is on your glossary of terms, we're talking about an individual or a population, as I mentioned earlier, the overall health and well-being. Now, when we look at overall health and well-being, we need to be reminded of last week's work in years 7 to 9 health, which is the 5 dimensions of health. And those 5 dimensions of health are, my apologies, I've got a phone call coming in. Those 5 dimensions of health are physical, social, mental, emotional, and spiritual. And you should be over the top of all of those anyway. So when you take into account all the different factors, such as life expectancy, which we'll talk about momentarily, and the amount of disability and levels of disease within a country or an individual, that will tell us what the status of health is for that country or individual. So when we do this, we explore the dimensions of health and well-being. We're able to use that as a measure of the level of health and well-being that different individuals, groups, or whole populations are experiencing. So for example, quite often when you look at the status of health within Australia, one of the indicators that comes up is the different groups. So I know that for many years, when I've been studying my physical education, we talk about how high the participation levels of physical education are within different population groups. So when I say population groups, I might be talking about those people who are in the overweight category. It could potentially be referring to Indigenous Australians. And as you look at these different population groups, you actually notice that the numbers and the trends actually are different. It's not that every single Australian has the exact same number of in their health status or their life expectancy or in their participation rates in healthy eating or physically active lifestyles. It's a very different trend depending on which population you're looking at. So when you measure the health status, we're actually able to then provide judgments that relate to the status of individuals, groups, or populations. When we make these judgments, if we are basing our judgments on the status and the numbers and the data that the measurement actually provides us with, then we're not just having a guess, we're making an educated decision. And in that educated decision, we look at past experience, we look at common trends that have happened in other countries or many, many years ago, and we're actually able to start to indicate whether people might be at risk of certain diseases or an early onset of death or something like that. So, government and non-government organisations take action to try and improve the health and well-being and guide further intervention. So if they notice that a population group such as overweight Australians are heading for an early demise in their life, or they might be at higher risk of certain health diseases, then companies like the Heart Foundation can jump in and provide healthy alternatives to eating, healthy alternatives to physically active lifestyles, and try and turn it around and make people's life expectancy longer and make them live healthier lifestyles. So we can look at trends, and trends are going to help us in the future. You're now going to listen to me talk about a health continuum, and it's going to be a task on the next slide that's going to ask you to use this health continuum. So now that we've talked about health status and some of the different indicators and why we need to look at health status, what we're going to look at is the fact that people aren't just healthy or not healthy. People actually fit somewhere along this continuum, and countries and population groups sit somewhere on this continuum. So on this continuum, we have a high level of health over here. And as you can probably assume, all the things that you've been learning about for years and years and years, physically active lifestyles, maintaining a good balance of exercise, maintaining a good diet, and that diet has a good mixture of all the different health and food groups, that's somebody who will have a high level of health. But people in that high level of health, whether they're individuals or populations, they will also be absent of disability, absent of disease that underpins their health and lifestyles, and they are in a high level of health, optimum levels of energy, feeling of good well-being. All of the 5 health and well-being dimensions are hitting the high points in this section here. But this is a continuum, so anybody or any population can plot at any point along this continuum. And on the other end of the continuum, we have premature death. That means that you have not reached what you should have as your maximum lifespan, and death has come upon at an earlier age than expected. People in this category are making poor life decisions. They're making decisions that are around different eating styles, lack of physical activity, high risk behaviors like drugs and alcohol consumption, not getting enough sleep. It might also be that these people have a predisposed disorder or disability that could be doing something to their insides and therefore can lead to premature death. And when we say premature death, we're saying that that person has not hit their life expectancy. So all of us have a current life expectancy, which is the next thing I'm going to talk about today. And if people are dying before their life expectancy, that is what we would consider a premature death. So this health continuum, let's look at 2 different examples here, and both these examples use the word hypertensive, which is somebody who has high blood pressure. That means their heart is having to work very hard to supply oxygen to the rest of their body. So, a hypertensive male, and it's important that we said male because males and females have different life expectancies, who only takes his medication without making any other lifestyle changes. So we're talking about someone here, we make some judgments and assumptions that this person probably doesn't exercise a lot because they have high blood pressure. They might be eating some poor foods. Maybe something else is going on with their disabilities or disorders, but they are actually taking some medications. So we would probably say the fact that they have high blood pressure and it's come on from these lifestyle changes, they're probably down in this section of the continuum here. But they are taking medications, so it's not going to be all the way down near the premature death, but it's going to be somewhere in the lower end of this continuum. Now, if we look at the next one, we have a hypertensive male who not only stops taking his medication, but is also smoking. My apologies. A hypertensive male who not only takes his medications, but stops smoking, loses weight, and starts an exercise program. So while the first male was sitting somewhere lower on this continuum, we would say that by stopping smoking, losing weight, and starting an exercise program, it's going to improve the levels of energy. It's going to take away some of those aches and pains on the joints and bones of the body because of the extra weight that will be lost. And also the medications are going to be more effective because the smoking has stopped, because we know that smoking causes clogging within arteries, which can be putting pressure on the blood. So we might be saying that this person has slightly improved health and wellness, and if they continue down this new model, which is explained here, then they might actually end up close to the high level of health within the health continuum. You guys are now being asked to draw a continuum in your book or on your Microsoft Word, and you can even use the one that's there if you wanted to copy and paste it across. You need to make sure that you have death, poor health, normal health, good health, and optimal health as your indicators, so you can write them along that continuum. And then what I would like you to do is to create an example of an individual whose health status would be placed on each end of the scale on that continuum. So one scenario must be of that optimal level, and one scenario is somebody who's definitely heading towards that premature death. So once you've completed that task, you might want to pause this YouTube. You're going to continue on. We've got one more thing to talk about today. Okay, so back to taking a few little notes here. And what I'm going to ask you to do right now is to have a look at this. These are some of the indicators of what the health status for an individual or a population is sitting at. So these are some of the things that the professionals will want to look at for an individual or for a population group to try and make sure that they get a real good sense before they make that judgment on the data that's being collected so that they can make an informed judgment call based on data. So each of these health status indicators, we will talk about them as we go forward, but there's a couple I want to look at right now. The first one is the self-assessed health status. When we look at the self-assessed health status, we are basing an individual's own perception of their health and well-being. So we need to inform them what health and well-being is and let them make an informed decision about their life. Now, this is a subjective measure, meaning that the subject themselves, which is the person being assessed, they're going to make their own assessments. So one person might actually assess themselves as pretty excellent in terms of their health status. They feel like they're physically fit, even though their mental and emotional healths are quite poor. And it could work the other way around as well. You might have somebody who is actually in quite good health, but they're very critical of themselves, and therefore they might assess themselves as lower health than what they actually are. So we need to be careful when this is a subjective measure. So the people are being asked to rate their level of health and well-being in all 5 of those categories on a range from excellent, very good, good, fair, and poor. Now I'd like this to be your turn. So in your notes, for each of the 5 dimensions of health and well-being, a reminder: physical, social, mental, emotional, and spiritual. I'd like you to indicate your current health and well-being. And you could go excellent, very good, fair, or poor in each of the categories. I don't need to know reasons as to why. This is all individual and it's subjective, and be honest, because we are in a pandemic and things are slightly different at the moment. But just give your own health and well-being rating in each of those 5 categories before we move on. So you can see how easy it would be to do this, do it properly, but also maybe even lie or make a mistake. The final thing that I wanted to go through today is life expectancy. So, life expectancy is an indication as to how long a person can expect to live if the current death rates stay the same. Now, right now in the world, the death rates are obviously much higher than usual because we're in a pandemic. Now, if this pandemic continues on longer than expected, then life expectancy will take a turn. Because what we're noticing is that currently the people who are already in slightly poor health are the ones who are predisposed from dying from COVID 19 more so than healthy individuals. That doesn't mean that healthy individuals aren't dying from COVID 19, but when you listen to the Premier Daniel Andrews and when you listen to Scott Morrison, the Prime Minister of Australia, and they talk about the current death rates of COVID 19 every day in their press conferences, quite often you notice that the people who are passing away are the people who have predisposed conditions. They're already lower on that health continuum that we were talking about earlier for their health status, and COVID 19 is kicking in, which is bringing their life expectancy down a little bit. Now, if this common trend continues to happen, we will actually notice that the numbers you're going to see on the next slide will take an effect and a hit by this. However, let's get back to some positive news. Life expectancy is only an indicator, okay? It does not reflect the health status of a population, a group, or a country. It only provides indication as to what you can expect to happen with the lifespan. So here's a little bit of a table for you with some data in it that is there's up to date as of 2017. Now, need to explain this to you. At birth, for a male, the expectancy of the life is to live to 80 years and a half. As that male progresses through their life, we expect them to live slightly longer. It's indicating the lifestyle choices are ones that lead you towards the higher end of that health status continuum. So the people who partake in high risk living and behaviors, they will know by the age of 30 that their life expectancy is not going to make those extra 10 years at the rate in which they're going because they're lower on that health status continuum. So as you hit each of these new age categories, the expectation of how long you will live grows higher and higher. What you'll also notice is the indicator of that life from 1901 to 1910 was much, much lower than what it is in 2015 to 2017. And even now, if you Google the current life expectancy for Australian males and females, on average, it's sitting higher than this already. At birth, I believe it's at 83.5 is the current norm from birth. And as you go up, it continues to go up as well. This is for both males and females. And there's 2 things I want you to look at. Number 1, a male at birth is expected to live 4 years less than a female. And even at the age of 85, a male is expected to live 1 year less than a female. Start thinking about why you think that might be the case. And then I want you to answer this question in your notes as well. What do you think has contributed to an increase in life expectancy from 1901 to 1910 all the way to 2015 to 2017? I want you to put them into your notes And that will be absolutely plenty for today's session. Don't forget to go back to the glossary and continue to add to these words. And once again, this Monday class of the week is always an introduction to some new content, really filling your brain with this knowledge. If you need to pause this YouTube and come back to it to finish off these notes and this task across the full 75 minutes, then please do so. But don't forget to upload that at the end of the lesson so that I can track about how you're going and if we've got any issues for you individually or for the class. On Wednesday and Thursday's task, we're going to take these measurements and we're going to push forward with them with a Venn diagram activity, a couple more case study activities, and some more vision to watch about different individuals and a documentary, similar to last week. And if you have any feedback about how our classes are traveling, please let me know so that I can make some changes so that you're enjoying it as much as possible. Good luck with today's work, and I'll see you soon.